everyone, welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are the latest developments from the world of medicine. A new computer tool that can track the stroke rehabilitation to boost a patient's recovery. According to a new study, a sensor-equipped computer program can accurately identify and count the movements in people who are undergoing stroke rehabilitation. Now that it can do so, the next step is to use the tool to define the intensity of the movements that bring about the greatest recovery in patients' ability to move independently and also take care of themselves after a stroke. The study showed that the tool was 77% effective in identifying and counting the number of arm motions prescribed during the rehabilitation exercise phase for stroke patients. The sensors were strapped to the arms and back and were used to track the movements in 3 dimensions. The developers say that they plan further testing on more stroke patients to refine their own computer model, cut down on the number of sensors that are needed, and then develop a smaller prototype device that could be worn on the arm or the upper body. Published in the journal PLOS Digital Health, this study recorded the upper body movements of 41 adult stroke patients while they performed routine rehabilitation exercises for regaining the use in the arms and the hands. The exercises in the arm movements involved patients feeling themselves with a work and grooming themselves with a comb. More than 51,600 upper body movements were recorded from 9 sensors, with the digital recordings of each arm movement then matched to functional categories such as whether the movement involved reaching for a particular object or holding it still. Artificial intelligence, that is, as we call it in layman language, which is machine learning software, was then programmed to detect the patterns within the data and tie these patterns to specific movements. The resulting PrimeSec tool was then tested on a separate group of 8 stroke patients who wore the sensors while performing various types of exercises. Hence, it was observed that the program was successful in accurately assessing the majority of movements in patients, all of whom had mild to moderate arm impairments from stroke. The long COVID risk during the Omicron phase compared to the Delta variant. A new research published in the Lancet journal has revealed that the Omicron variant is less likely to cause a long COVID syndrome than the Delta variant. The findings are from the first peer-reviewed study to report on long COVID case and the Omicron variant. The researchers found that the odds of experiencing long COVID were between 20 to 50% less likely during the Omicron period versus the Delta period, depending on the age and the time since the vaccination had started. The study identified close to 56,000 adults first testing positive between the period when the Omicron was the dominant strain, and the researchers compared these cases to close to 41,000 cases which were first testing positive during the Delta variant. The analysis showed that 4.4% of the Omicron cases were long COVID compared to 10.8% in the Delta period. However, the absolute number of people experiencing long COVID was in fact higher in the Omicron period. Now, why is this? The reason that the researchers gave was because of the vast number of people that were infected with the Omicron variant. Therefore, the authors mentioned that the Omicron variant appears substantially less likely to cause long COVID than the previous variants, but still 1 in 23 people who catch COVID-19 go on to have symptoms for more than 4 weeks period. Given the number of people who are affected, it is important that all of us continue to support them at work and at home. The drop in the rates of Kawasaki disease during the COVID-19 pandemic. According to the recent study that was published in the JAMA Network Open Pediatrics, the researchers found that the Kawasaki disease per se, these cases fell by 28% in 2020 and also remained low during the peak pandemic period. The drop, they said, was associated with school closures, masking mandates, decreased ambient air pollution, and also reduced circulation of respiratory viruses. This disease, in the cases, rebounded back in the spring of 2021, coinciding with the lifting of masking mandates and the return of in-person schooling. While this condition affects less than 6,000 children each year, the disease still continues to puzzle the pediatricians as its exact triggering modes and the entry into the body have not yet been identified. Unlike COVID-19, this disease is not contagious. However, the discovery that precautions against the coronavirus were effective in reducing Kawasaki disease suggests that its triggers are similarly inhaled into the upper respiratory tract. The results from the analysis showed that the rates of Kawasaki disease are typically higher in males and Asian children, and that these groups they saw especially large drop in cases during the pandemic period. It was also mentioned that the another group they saw a disproportionately decrease with children aged 1 through 5. This was notable when compared to the infants who saw no significant change in the Kawasaki disease rates during this particular period. The reason that they gave was less likely because infant behavior was not as significantly impacted by the pandemic, while typical activities and exposures for the older children changed more dramatically. Therefore, the authors concluded that the patterns suggested that social behavior affects the exposure to the agents that trigger the Kawasaki disease and are consistent with the respiratory portal of entry. The risk of dementia after smoking cessation in patients with newly diagnosed atrial fibrillation. According to a new study published in the JAMA Network Open, smoking is associated with a significantly higher risk of dementia in patients with new onset atrial fibrillation, while smoking cessation after an atrial fibrillation diagnosis was associated with a lower risk of dementia than among the current smokers. Now let's go through this study in a little detail. Now, we all know that atrial fibrillation is the most common cardiac arrhythmia with an increasing prevalence in the elderly, conferring a high risk of adverse cardiovascular outcomes and healthcare costs. Cognitive dysfunction is prominent among such class. This nationwide cohort study that I'm talking about included a total of close to 1,26,000 patients who had a national health checkup examination done within 2 years before and after an atrial fibrillation diagnosis. While based on their smoking status, the participants were classified as those who did not smoke, that was never smokers, ex-smokers, those who quit smoking, and current smokers. Patients were followed up until dementia, death, or the study period, whichever period ended first. The results of the study showed that 51.9% were non-smokers, 27.5% were ex-smokers, 7.1% those who quitted smoking, and 13.5% were current smokers. During a median of 3 years of follow-up, dementia occurred in close to 5,900 patients. Hence, the researchers concluded that although smoking is associated with a significantly higher risk of dementia in patients with new onset of atrial fibrillation, but if the smoking stops, if there is smoking cessation after an atrial fibrillation diagnosis, that was associated with a lower risk of dementia than among the current smokers. These findings may support promoting smoking cessation programs to reduce dementia risk in patients with new onset atrial fibrillation. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.